Hello friends. Right now there are seniors across this country paying as much as $500 a month more for Medicare than they actually have to, and most of them have no idea it is happening. It does not show up as a bill you can argue with. It is deducted quietly straight out of your Social Security check before the money ever reaches your bank account. And for a large number of people paying it, the charge is either wrong, outdated, or completely fixable with a single form. Today I'm going to show you exactly why this happens, who is most likely to be overpaying, and the specific fixes that can put that money back in your pocket, starting with the one that reverses the biggest overcharge of all. Let me be honest with you up front. Not every senior is overpaying, and I will tell you exactly who is and who is not. Medicare is the one bill that follows you every month for the rest of your life. So an overcharge here is not a one-time sting. It compounds month after month, year after year. The fixes I am about to give you are not loopholes or tricks. They are official Social Security and Medicare programs that exist precisely for the people who need them, and that most people simply never use. But if you fall into one of the groups I'm about to describe, this could be the most valuable few minutes you spend all year. Before we get into it, subscribe to this channel right now and turn on the bell. Medicare rules change every single year, the numbers shift, and nobody at Social Security calls to tell you that you are paying more than you owe. They deduct it and expect you to already know. Subscribe now and let's get into it. First, let me show you where that $500 actually comes from, because once you see it, you will understand the fix. In 2026, the standard Medicare Part B premium is $202.90 a month. Most people pay exactly that. But if your income is above a certain level, Medicare adds a surcharge on top called IRMAA, the Income-Related Monthly Adjustment Amount. And this surcharge is steep. At the higher income levels, the Part B surcharge alone can add up to $487 a month on top of the standard premium. And the Part D drug surcharge can add another $91 a month. Put those together, and a senior can be paying close to $580 a month more than the standard rate. Well over $500 in extra charges every single month. Here is the part that catches people. IRMAA is based on your income from 2 years ago. Your 2026 Medicare premium is calculated from your 2024 tax return. So if you earned more in 2024, maybe you were still working, maybe you sold a house, maybe you took a large withdrawal, you can be charged a surcharge today based on income you no longer have. And it works as a cliff. Going just $1 over a threshold pushes you into the full higher tier for the entire year. Most Medicare beneficiaries, I want to be clear, do not pay IRMAA at all. It only begins above $109,000 for a single filer or $218,000 for a couple. But for the people it does hit, and especially for the people wrongly caught in it, the numbers are large enough to matter enormously. And there is one group hit hard that almost nobody warns about: widows and widowers. When a spouse passes away, the surviving partner often goes from filing jointly to filing as a single person the very next year. Their income may barely change, but the single filer thresholds are far lower, so a widow can suddenly be pushed into a surcharge she never paid while her husband was alive, at the worst possible time. Now here is fix number one, and it is the most powerful one, because it reverses the charge when it should not apply to you at all. If your income has dropped since 2024 because of a specific life event, you do not have to sit and pay this surcharge for a year waiting for it to correct itself. You can appeal it right now. The form is called SSA-44. It is free and it exists specifically for what Social Security calls a life-changing event. Those events include retiring or stopping work, the death of a spouse, divorce, or a loss of income-producing property. If any of those happen to you, you file the SSA-44, you attach proof, a retirement letter, a death certificate, a divorce decree, and Social Security recalculates your premium based on your current lower income instead of the 2-year-old figure on file. And if your surcharge came from a true one-time event, selling a home, a single large IRA withdrawal, a Roth conversion, there is good news even if no life event applies. Because IRMAA is recalculated every year, once that income drops back down, the surcharge falls away on its own the following year. You are not stuck with it forever. But when a life event caused the drop, the SSA-44 gets it fixed now instead of making you wait. The approval rate for legitimate life-changing events is high, and yet an enormous number of people never file it, either because they do not know it exists or they assume they will be turned down. If you got an IRMAA notice, you have 60 days from receiving it to appeal, so do not sit on it. Fix number 2 is for married couples, and it is one of the most expensive mistakes in the entire Medicare system. It involves how you file your taxes. If you are married, but you file your taxes as married filing separately, Medicare treats you completely differently and not in your favour. A single filer with income just over the threshold pays a modest surcharge, but a married person filing separately with that same income jumps almost immediately to one of the highest tiers, paying around $500 and $29.60 a month in combined Part B and Part D surcharges, roughly 5.5 times what a single filer pays at the same income. Same income, more than 5 times the Medicare cost, purely because of the filing box you checked. To put it plainly, 2 people with the exact same income, one filing single and one married filing separately, can be paying a difference of more than $400 a month for identical Medicare coverage, nearly $5,000 a year, decided by a single checkbox. For most couples, filing jointly instead of separately eliminates that penalty entirely. If you and your spouse have been filing separately, this is worth sitting down with a tax preparer to review, because that one change on your return could save you thousands of dollars a year on Medicare alone. Fix number 3 goes in the opposite direction. It is for seniors whose income is not high but low, and who are paying that $202.90 Part B premium every month, when they may not have to pay it at all. These are called Medicare Savings Programs, and they are run through your state. If your income and savings are below certain limits, one of these programs will pay your entire Medicare Part B premium for you. That is $202.90 a month, roughly $2,435 a year, simply covered. There are several versions depending on your income level, and some also help with deductibles and co-pays. There is a companion program for prescription drug costs called Extra Help, which lowers what you pay for Part D. Here is the tragedy. Millions of seniors who qualify for these programs never enroll, either because they never heard of them or they assume they earn too much. The income limits are higher than most people think. As a rough guide, some of these programs reach single seniors with monthly incomes into the $1,700 or $1,800 range, and higher for couples, and a few states are even more generous, with no asset limit at all. Do not assume you make too much to qualify, because the people who assume that are exactly the ones leaving thousands of dollars on the table. If you are living on a modest fixed income and paying that full Part B premium out of your Social Security check every month, it is absolutely worth calling your State Health Insurance Assistance Program, your local SHIP office, to check whether you qualify. That is free help, and it exists for exactly this. Fix number 4 is the one almost everyone can use, whether your income is high or low. Review your actual plan every single year during open enrollment. Medicare's annual open enrollment runs from October 15th through December 7th. This is the window when you can change your Part D drug plan or your Medicare Advantage plan for the following year. Here is why it matters so much. Insurance companies change their plans every year. The premiums go up, the list of covered drugs changes, your pharmacy may drop out of the network. The plan that was perfect for you 2 years ago may now be costing you hundreds of dollars more than a different plan that covers the exact same medications. But most people never reshop. They stay in the same plan out of habit and they overpay year after year. Every fall, go to medicare.gov or call your SHIP office and run your specific medications through the plan finder. One more thing most people miss during open enrollment. It is also your chance to switch between original Medicare and a Medicare Advantage plan, or to change Advantage plans entirely. So if your plan raised your co-pays or dropped your doctor, this is the one window each year when you can walk away. People who reshop often find a plan that saves them hundreds of dollars a year for identical coverage. So here is the full picture. If you are paying a Medicare surcharge, that IRMAA is based on your 2024 income. And if your income has since dropped because of retirement, a death, a divorce, or a one-time event, file the SSA-44 to appeal it. You have 60 days from your notice. If you are married and filing separately, know that it can cost you around $529 a month in surcharges, and filing jointly usually erases that. If your income is low, call your SHIP office about Medicare Savings Programs, because your entire $202.90 Part B premium may be paid for you. And every single fall, during open enrollment from October 15th to December 7th, reshop your Part D and Advantage plan, because staying put out of habit is how people quietly overpay for years. Subscribe, turn on the bell, and share this with someone on Medicare so they can check whether they are one of the people overpaying and fix it before another month goes by.